It is a New Year's resolution for many to get healthy, to lose weight, to try to live an overall balanced lifestyle. But the question is, how exactly do you do that? Well, our next guest says that he has some advice in that arena. Joining us now is Dr. Sean McHugh, is the owner and clinic director at McHugh Chiropractic and Healthcare, and he's also brought along with him one of the people that he has helped, Billy Frick. He is here to share his story. It's good to see you both. Thanks for being here. We appreciate it. And Billy, we'll get to your story in just a second. But first, let's talk to you, Dr. McHugh, and talk about something that you practice, you say, in your office, and that is functional medicine. So what exactly is functional medicine?
Functional medicine addresses the underlying cause of disease using a system-oriented approach in a way that the client and practitioner engage in a therapeutic partnership, meaning we address the body as a whole, not just an isolated set of symptoms.
Okay, is this somebody who comes in and they have a problem that they want addressed, or is this more of the preventative side of things where, you know, I feel great now, I want to come in and get checked out, and maybe there's an issue that I should be aware of that should be looked at as we go down the road? Yeah,
it can be both. We see patients for health reasons that want to stay ahead of the game. We also see patients who come in with something going on that we have certain tests that we do and we run in office that can help us get to more of the cause of the issue rather than just the symptoms.
And a full body approach, right? We're not just and so how does that work? I mean, is this a long test? Are we in your office all day? You're a nice guy, but nobody really wants to spend the entire day with you, right?
No, there's only a few tests that we run in our office. If patients don't come in with stuff like blood work, then we'll refer for that, but there's 3 main tests in our office that can find ultimately the cause of most chronic sickness disease, which is going to be cellular dysfunction.
Cellular dysfunction. And there's something that you have also called true cellular detox. What is that?
It's basically getting to the cell. You have to get to the cell to get well, ultimately. And there's 3 components in 3 phases. What it's not is a colon cleanse or a foot bath, a bottle of Coriella tablets, a juice fast.
I was not going to go there. I don't even know.
A coffee enema. I don't think you're
okay. Yep, not sure what that
It's ultimately getting to upstream to target the source of cellular dysfunction.
Okay. All right, really, let's bring your story in and talk a little bit about, you visited Dr. McHugh here. Why did you visit him? What did you find out? What did you learn?
I've learned a bunch. He's truly into finding the cause of the problem. Briefly, without going into great detail, I had some skin issues that I'd been to 5 different dermatologists and even a stint at Mayo Clinic. And I heard about him through your last show that my wife watched and decided to give it a shot. And I started going to him, and the benefits have been wonderful. We're not all the way there with the skin issues yet, but a lot of the byproducts is I've lost a lot of weight, I feel a lot better, higher energy. It's just been a truly wonderful experience.
Yeah, Dr. McHugh, I don't know if you want to get into the particulars of Billy's story, but talk a little bit about your relationship with him and what you have been doing.
Yeah, it's more of a coaching program. We have a patient who's like Billy, who's really compliant and really on the farther cutting edge of learning what he needs to do to ultimately change the life that he has now for himself, and that he can teach the rest of his family. Goes beyond just having a patient-doctor relationship. It's more of an interaction and a partnership where we work together to get patients to the next level of their health.
And beyond the tests, would you say it's incorporating an overall healthy lifestyle when it comes to eating and the exercise? That obviously plays a big role in it, you would say?
Absolutely. Diet is a big deal. Exercise is a big deal. This guy works out 6 days a week, so he does his part on his own, and that's, I think, one of the big reasons why he's seen quite a bit of results is engaging himself in the lifestyle that he needs to live. So if it was just diet, everyone would be healthy. If it was just exercise, everyone would be healthy.
But it's
there's a combination, yeah.
Right?
And then there's other things that we talk about and do as far as varying diet and intermittent fasting, and those types of things that can get the body to the next level of health.
Fasting, okay. And so this is just one example of a condition that you see come through your office. What else do you find that's pretty common with the patients who come through your office?
Big one is weight loss resistance despite diet and exercise, brain fog, chronic fatigue, muscle and joint pain, and then other hormonal issues like diabetes and thyroid issues.
So your advice would be for people is what?
Take action now.
Just take action. Billy, would that be the same advice for you?
Absolutely. Take action.
6 days a week, huh?
6 days a week.
That's impressive.
And
working out, where do you, walking, running, riding bikes?
Anytime Fitness.
Yeah.
Okay, good deal. Another little plug in there.
Yeah, a little plug in there.
It's easier when you own a gym. So.
There you go. Very good.
But one more thing I do want to say about Dr. McHugh is he is passionate about what he does. Not only have I got family members going to him, but I've referred numerous friends to him. he cares about fixing the problem.
Well, there you go. All right. Well, thank you, gentlemen, for joining us.
Thank you very much.
Appreciate it. Appreciate you being here. And of course, thanks to McHugh Chiropractic and Healthcare, of course, for coming on and providing us this content. For more information, you can visit McHugh Chiropractic by going to their website, which is on your screen. You can also call them 904-880-1399.